Okay, I think I've just about got my mind around all this. But there was one other thing you mentioned. Pasta, wasn't it? No, rice.
Rices, actually. R-I-C-E-R-S.
All right, I'm ready.
Injuries to soft tissues also mean injuries to blood vessels, which swell and leak. The more blood collects around an injury, the longer the healing period. The Rice's procedure helps to control internal bleeding.
You use Rice's, R-I-C-E-R-S, at the time of an acute injury, an acute joint injury or an acute soft tissue injury, that's when you need to apply your sort of initial first aid management. The R stands for rest, which is obviously designed to reduce further damage. It makes no sense to leave a significantly injured or damaged player on the sporting field because that is going to increase the severity of the injury. Ice is used to reduce pain. Ice is also used to help reduce inflammation and swelling. So the consensus is that ice is applied with any acute injury involving internal soft tissue injury or bleeding. Compression is also used to help prevent excessive internal bleeding. It's accepted that if there is uncontrolled bleeding and substantial swelling in a soft tissue injury, that then delays the healing. E in Rice's stands for elevation. That, along with compression, is used to help reduce the build-up of fluid swelling in the area of the injury and the internal bleeding. So you elevate the injured part above the level of the heart, and that helps to prevent excessive swelling build-up. R stands for referral, and that means that having made an initial assessment of the injury, you need to refer your injured player or athlete onto an appropriate medical personnel, physiotherapist or doctor for a further assessment of the problem. And S finally stands for stretch, which means that you can, in the acute management of the problem, put the part on stretch in the case of a soft tissue injury to a muscle, and that can be done whilst you're icing the injury, but is probably the least critical part of the overall management.
And of course, while you're applying your Rice's procedure, no harm should be done.
Of course, if you're injured, you don't want to harm yourself anymore.
That's right. And the way to avoid further harm is to make sure there's no harm.
Oh, wait a minute. I'm confused.
Okay. No HARM. No heat, like spas, saunas, baths or liniment. No alcohol in the first 24 hours. No running or exercising the injured part. And no massage.
When treating a soft tissue injury, remember Rice's. Rest, ice, compression, elevation, referral and stretching. Apply Rice's with no harm, that is, no heat, alcohol, running or massage. When an injury first happens, the first stage in aiding healing and recovery is to treat it appropriately.
Well, the process of healing starts shortly after the very acute phase of the injury and the initial trauma, initial damage and internal bleeding. Most soft tissues heal by scarring, and that process is reasonably predictable over around about a sort of a 6-week period. If you're comparing that to a hard tissue injury such as bone, what sets that apart is that the bone makes new bone. So rather than scarring, it makes new bone. And in a non-weight bearing bone, such as an upper limb injury, an arm injury, that's considered to be around about 6 weeks. And in a lower limb or weight bearing bone, it's considered to be around about 10 to 12 weeks.
During rehabilitation, further treatment is likely to be needed, which should be carried out by a physiotherapist.
So does the club have a physiotherapist that can help with rehabilitation?
Oh yeah, Dr. Casey.
Oh, more acronyms?
No, Dr. Casey.
Oh.
Sports physiotherapists use a very wide range of techniques for the treatment of sports injuries. We might use spinal mobilisation, manipulation, stretching techniques for the treatment of the spine. We might also help an athlete with posture correction and become involved in the analysis, from a biomechanical standpoint of their throwing technique or their running technique and that type of thing. For soft tissue injuries, we would use, again, a wide variety of techniques, including some electrotherapy, some massage, some stretching, conditioning exercises. And for more complex injuries, we might also need to completely rehabilitate sort of movement patterns and sporting skills and help the athlete to regain some personal confidence in their ability to perform their sport once again. So sports physiotherapists use a very wide range of tools, and we also call upon the expertise of a lot of other health practitioners where necessary to help the rehabilitation of a sports person. Stretching and flexibility are both very important for injury rehabilitation. We use stretching techniques a lot to restore the movement to stiff joints after injury, and of course we also use them to restore the normal length of a muscle after soft tissue repair. Flexibility, on the other hand, I think is equally important for injury prevention as it is for sports performance. And with the repeated trauma of training and competition, a lot of athletes find that their flexibility deteriorates. So whilst I wouldn't choose to excessively stretch a stiff or a relatively stiff athlete, as a matter of course, I would certainly use flexibility, stretching techniques and some other modalities such as yoga and Pilates to help an athlete maintain sufficient flexibility for them to have good performance in their sport. Muscle endurance is important. When one considers the sport that you're rehabilitating someone to, one needs to consider the type of muscle contractions that they'll be performing in their sport. So the rehabilitation needs to mimic, at least in the latter stages, it needs to mimic those sporting skills. Proprioception is a word that refers to your joint position sense. So it's your ability to maintain good balanced body position when you're bearing weight through your legs. We often think of it in terms of single leg weight bearing, or what your balance is like on one leg.
Healing occurs in different ways. For example, soft tissue injuries heal by scarring, but bones heal by growing new tissue. Different injuries take different lengths of time to heal. Ligaments, and particularly tendons, are slow, while bones are quicker by comparison. A variety of rehabilitation techniques are used by physiotherapists and other medical professionals. Sports injuries. They will always happen, and they must always be taken seriously. By following the right procedures when an injury occurs, applying the right treatment and undergoing proper rehabilitation, athletes have the best possible chance of returning to play their sport of choice.